Welcome to Pet First Aid and CPR. How to provide first aid and CPR to our loyal dog and cat companions. Brought to you by Pawzooks.
Introduction to Pet First Aid. Pet First Aid is a vital skill that every pet owner should possess to ensure the well-being of their furry companions. Being prepared to administer first aid can significantly affect your pet's outcome, whether it's a sudden injury, a choking incident, or a sudden illness. Understanding how to assess your pet's condition, administer essential treatments, and seek professional help when necessary can mean the difference between life and death.
This introduction to Pet First Aid aims to equip pet owners with essential knowledge and techniques to effectively respond to emergencies and provide immediate care until veterinary assistance is available. By learning the fundamentals of Pet First Aid, owners can be better prepared to handle unforeseen circumstances and safeguard the health and safety of their beloved pets. Principles of Pet First Aid. Preservation of life. The foremost priority in Pet First Aid is promptly assessing and addressing life-threatening conditions. This may involve interventions such as opening the airway, initiating CPR, or controlling severe bleeding. Prevention of further harm. Rescuers must prevent exacerbating the pet's injuries or illness. This includes immobilizing fractures, stabilizing the spine in cases of suspected spinal injury, and ensuring a safe environment free from hazards. Promotion of recovery. Pet First Aid facilitates the pet's recovery process by providing appropriate care and support. This may involve administering medications, dressing wounds, or providing emotional support. Recognition of limits. While Pet First Aid training equips individuals with valuable skills, it is essential to recognize the limitations of one's knowledge and abilities. Rescuers should know when to seek additional assistance. Importance of Pet First Aid. The importance of Pet First Aid cannot be overstated, as it can significantly impact the outcomes of pet medical emergencies and injuries. Immediate intervention can mean the difference between life and death in critical situations such as cardiac arrest, severe trauma, or choking. Additionally, by empowering individuals with Pet First Aid skills, communities can become more resilient and better equipped to respond effectively to emergencies. Providing Pet First Aid and CPR. Immediate care. Once the scene is deemed safe and the pet's condition assessed, initiate appropriate first aid interventions promptly, addressing any life-threatening injuries or conditions first. CPR protocol. If the pet is unresponsive and not breathing normally, begin CPR immediately by performing chest compressions and rescue breaths if you feel comfortable doing so. Scene assessment. Evaluation. Quickly evaluate the scene to determine the number of pets, their condition, and any immediate threats or hazards. Assess responsiveness. Check the pet's level of consciousness by tapping and shouting to elicit a response. Assess for any signs of life-threatening conditions such as breathing difficulties or severe bleeding. Environment. Take note of environmental factors such as temperature, weather conditions, and access routes for emergency responders. Creating a Pet First Aid Kit. What is a Pet First Aid Kit? A Pet First Aid Kit is a collection of supplies and equipment for initial medical treatment in case of minor injuries or illnesses. These kits are typically assembled to be portable and convenient. The contents of a first aid kit can vary depending on factors such as intended use, specific needs, and regulations, but everyday items often include bandages, gauze pads, adhesive tape, antiseptic wipes, scissors, tweezers, gloves, pain relievers, and instructions on basic first aid procedures. Creating a first aid kit. It's essential to seek professional veterinary help for severe injuries or medical conditions. Choose a container. A durable, waterproof container holds your pet's first aid supplies. It could be a plastic box, a sturdy bag, or a dedicated first aid kit pouch. Make a list. Compile a list of items you think are essential for your pet first aid kit. Consider potential emergencies you might encounter and tailor the contents accordingly. Pet Information Card. This should have several tidbits of helpful information, including your pet's name, emergency contact, veterinary information, and information about their age, microchip number, and diet and feeding schedule. Muzzle. When animals are in pain, They snap at the nearest moving object, which will most likely be your hand. We don't want this to happen, so to be safe, it is best to muzzle the pet until you are sure you aren't getting bitten. Types of muzzles. Soft muzzle. A soft muzzle is made from mesh or nylon and wraps around your dog's mouth, holding it closed. Basket muzzle. A basket muzzle sits like a cage around your dog's snout, which allows your dog to open and close his mouth but not bite. Some even allow for eating and drinking while wearing it. Creating a pet first aid kit. Rectal thermometer. It is essential to ensure your animal is not too cold or too hot. This is a handy tool when assessing the pet and their condition. We recommend having 2 people take a pet's temperature. Anything over 103 degrees Fahrenheit, 39 degrees Celsius is a fever. They should be cooled down and taken to the vet. On the other side of the spectrum, if your pet is below 98 degrees Fahrenheit or 36 degrees Celsius, you must warm them up as soon as possible and take them to the vet, as this can cause hypothermia. Slip leash. Having a slip leash is a great thing. It makes it easy to save dogs that do not have a collar, and it can be done at a distance if you are worried about getting bit because a dog has been injured. Bandages. Typically, when bandaging, you layer them so that nothing seeps through and the animals are less able to bite or scratch them open. We suggest non-adherent pads, cotton gauze, cohesive wraps, and pet adhesive tape. Pet nail clippers. This is important if your pet cracks or pulls off a nail. Most of the time, the best course of action is to remove the toenail if it is just hanging by a thread. This way, it doesn't tear off later when you aren't ready for it. Tweezers. These are good for removing splinters and stingers from bees. Everyone should have a pair of needle nose pliers in their bag if they need to pull something out, e.g., porcupine needles. Scissors or shaver. Sometimes, you must cut your pet's hair if they have wet fur or to get closer to a wound. Be careful with scissors, as it is easy to nick your pet's skin. Shavers are preferred for this reason. Styptic powder. This powder is to help the pet's blood start clotting. You can also use cornstarch, flour, or a bar of soap to stop bleeding from a torn or clipped toenail. It is good to always be on hand. Sterile saline. This is for washing wounds and cleaning eyes. It is most commonly found in the contact lens section at your local drugstore. It is super easy to find and comes in big bottles. Just ensure that it only has regular saline and not more. 12 cubic centimeters syringe. Most people use this to measure out pet liquid medications and other liquids. It is good to have when you need to ensure a proper dosage. Some people will also use measuring spoons. Lubricants. The most used lubricants are mineral oil, petroleum jelly, and KY jelly. This is used when your pet must get their temperature checked anally. Caro syrup. This syrup is best used for low blood sugar or shock symptoms. You can administer light Caro syrup, honey, or sugar water at 1 tablespoon per 5 pounds. Remember, never give a puppy under 1 year old honey. Human medications for pets. Benadryl. This medication is an antihistamine used to stop pets from itching. It also works well as a sedative because it has a drowsy effect once taken. The dosage is 1 milligram per pound every 6 to 8 hours. Do not go over this amount, as it can cause side effects. Other forms of this drug include Target Allergy Relief, Kirkland Allergy Medicine, Heb Allergy Relief, Major Banofen, and Timely Allergy Relief. Make sure that the bottle says diphenhydramine HCI 25 milligrams. Dramamine. This medication is meant to prevent motion sickness and vomiting. You can give a dog 2 to 4 milligrams per lb 3 times a day, and a cat can have 1/4 of a 50 milligrams tablet, about 12.5 milligrams, once daily. Do not go over this amount, as it can cause side effects. Other forms of this drug include Equate Motion Sickness Relief, Major Driminate, and Walgreens Wild Dram. Make sure that the bottle says dimenhydrinate 50 milligrams. Dulcolax. This medication is used to prevent constipation. Dogs can have a 20 milligrams tablet once a day. Cats can have a 5 milligrams tablet once a day. Do not go over this amount. Other forms of this drug include major bisacodyl, TimeCap Labs stimulant laxative, and Equate gentle laxative. Make sure that it says Biscadyl 5 mg. Imodium. This medication is used to prevent diarrhea. A dog can take 1-2 mg pill per 50 pounds of body weight 2 to 3 times daily. This should only be given to larger dogs. The liquid version is a better choice for smaller dogs at 1 mg. Do not give to herding breeds such as Collies, Shelties, and Australian Shepherds. These dogs are unable to break down Imodium. Pepto-Bismol. This medication treats diarrhea, nausea, vomiting, and indigestion. This is okay to be used only by dogs at the dosage of 1 teaspoon for every 10 pounds every 6 to 8 hours. Other forms of this drug include Equate Stomach Relief, Good Sense Stomach Relief, and Exact Stomach Relief. Make sure that the bottle says bismuth subsalicylate before giving it. Neosporin. This medication is for preventing skin infections. It can be used on dogs and cats up to 4 times daily. Make sure that your pet does not lick it off. Other forms of this drug include Soundbody Triple Antibiotic, Walgreens Triple Antibiotic, and Equate Triple Antibiotic. Ensure the bottle says these medications bacitracin zinc, neomycin sulfate, and plymixin B sulfate before giving. 3% hydrogen peroxide. This medication is used to induce vomiting. It irritates the stomach and will make a dog vomit within 10 to 15 minutes. The dosage is 1 teaspoon per 5 pounds with a maximum of 3 tablespoons for dogs who weigh more than 45 pounds. We recommend waiting for at least 40 minutes before assuming your dog is done vomiting. Sometimes it can take up to an hour for it to finally finish affecting your dog. Here is a simple and easy chart to help you remember the human medications that pets can take. Primary assessments for pets. The first thing that you should always do is take your pet's temperature. To do this, you need to lubricate the end of the anal thermometer with mineral oil, KY jelly, or petroleum jelly. You then grasp the base of your pet's tail and lift it. You then insert it into the anal canal about halfway. Your pet will fight this, so have a firm grip on the tail to keep the pet from escaping or trying to sit down. After 3 minutes, or when it beeps, take it out and read the result. Be sure to wipe the thermometer with alcohol to disinfect the object. It is good to know that pets have a higher base temperature than humans. The average temperature for them is between 99 degrees Fahrenheit, 37 degrees Celsius, and 102 degrees Fahrenheit, 38 degrees Celsius. If their temperature is higher than 103 degrees Fahrenheit or 39 degrees Celsius, they have a fever. Anything over 105 degrees Fahrenheit or 40 degrees Celsius is severe, and pets should be taken to the vet. If your pet's temperature is below 98 degrees Fahrenheit or 36 degrees Celsius, then they should be warmed up to the best of your ability to do so. Anything under 95 degrees Fahrenheit or 35 degrees Celsius is severe, and pets should be taken to the vet for hypothermia treatment, as they are extremely cold. Here is a simple and easy pet temperature chart to help you remember. Capillary refill time. Capillaries are tiny blood vessels in your dog's skin that lie close to the surface. The standard color of your pet's gums should be a medium pink color. To check the capillary refill time, lift your pet's upper lip and press the flat of your finger against the gum tissue. This blocks normal blood flow to the gums. Remove your finger and count down the seconds it takes for the gums to return to the original color. Any color besides pink gums could be a sign that something is wrong with your animal. Pet gum colors. If your pet's gums are a medium pink color, that is normal. Pale/white gums are a sign of anemia and shock. Red gums are a sign of heat stroke or carbon monoxide poisoning. Blue gums are a sign of suffocation or smoke inhalation, and yellow gums are a sign of liver issues. Call your vet. Capillary refill times of more than 4 seconds indicate dehydration or shock. 1 to 2 seconds is usual. 2 to 4 seconds is possible dehydration or shock, and less than 1 second is a sign of potential heat stroke or shock. Call your vet ASAP. Here is a simple gum colors and capillary refill chart to help you remember. Dehydration testing. It is essential to ensure your dog or cat can access fresh water whenever they want it. To check for dehydration, lift the scruff of their neck and count how many seconds it takes to come back down. If a dog is hydrated, it will spring back to normal immediately. The slower the skin retracts, the more severe the dehydration. If the skin remains up even after you have released it, take your cat or dog to the vet as soon as possible. Here is a simple heart rates for pets chart to help you remember the information. Respiration in cats and dogs. Dogs normally breathe 10 to 30 times per minute, and for cats, the rate is 10 to 40 times a minute. Hot or exercising dogs breathe way faster than usual, topping out at 200 breaths a minute. Panting and open-mouthed breathing in cats is considered a dangerous sign. Call your vet. Effortless breathing, which is quiet and soundless, is normal. Excessive panting or gasping, labored open-mouthed breathing with blue gums, and slowed shallow breathing are abnormal. If your pet stops breathing or is unconscious, call your vet. Here is a respiratory rates for pets chart to help you remember the information. Abdominal injuries. What are abdominal wounds? A penetrating abdominal wound is an injury that pierces through the layers of the abdomen, potentially causing damage to internal organs such as the intestines, liver, spleen, or stomach. Call your vet immediately. Signs and symptoms. Visible puncture wounds or lacerations on the abdomen, bleeding, swelling, bruising, whimpering, reluctance to move, rapid or shallow breathing, weakness, lethargy, pale gums, vomiting, diarrhea, or abdominal distension. Signs of shock such as rapid heart rate, pale mucous membranes, or collapse may be present. Treatment for abdominal wounds. Minimize movement. Avoid unnecessary movement of your pet, which can worsen their injuries. If possible, gently lift your pet to the car using a stable surface like a flatboard.
Control bleeding.
Apply gentle pressure to any visible bleeding using a clean cloth or gauze. Avoid applying excessive pressure that could further injure your pet. Keep warm. Keep your pet warm by covering them with a blanket or towel, especially if they are in shock. Avoid overheating them, as this can worsen their condition. Prevent choking. If your pet is vomiting or has difficulty breathing, keep their airway clear by gently tilting their head to the side or wiping away vomit or saliva. Do not offer food or water. Refrain from offering food or water to your pet, as they may require anesthesia or surgery upon arrival at the veterinary clinic. Drive safely. Drive carefully and obey traffic laws while transporting your pet to the vet. Try to minimize sudden movements or bumps in the road. Abscesses. What are abscesses? An abscess develops when germs get caught beneath the skin, and there is no place for the infection to drain. Most pets with an abscess require antibiotics. They must take all of the medication to ensure the infection has been cured. Some abscesses require stitches or a soft latex tube to help drain the infection fluid from the pet's body. Signs and symptoms. Swelling, pain, discomfort, warmth to touch, foul odor, redness, inflammation, drainage or pus, licking or chewing, fever, lethargy, decreased appetite, and swollen lymph nodes. Treatment of abscesses. Clean the area. Use a mild antiseptic solution such as chlorhexidine or diluted povidone iodine to clean the skin around the abscess. Gently wipe away any discharge or crusting to help prevent further infection. Warm compresses. Applying warm compresses to the abscess several times daily can help promote drainage and relieve discomfort. Use a clean cloth soaked in warm water and gently apply it to the affected area for 5 to 10 minutes. Do not squeeze or manipulate. Avoid squeezing or manipulating the abscess, as this can cause further pain, spread infection, and delay healing. Let the abscess drain naturally or with the help of warm compresses. Monitor for changes. Keep a close eye on the abscess for any changes in size, color, or discharge. Contact your veterinarian for further guidance if you notice worsening symptoms, such as increased swelling, redness, or foul odor. Prevent licking or chewing. If your pet is licking or chewing at the abscess, consider using an Elizabethan collar, cone collar, to prevent further irritation and contamination of the wound. Hydration and nutrition. Ensure your pet can access fresh water and offer small, easily digestible meals to maintain hydration and nutrition. Encourage your pet to eat and drink, as adequate nutrition is essential for healing. Anal gland impaction. What is anal gland impaction? Anal gland impaction, also known as anal sac impaction, is a common condition in dogs and occasionally in cats where the anal glands fail to empty correctly. When the anal glands become blocked or do not empty properly, the secretions can build up, leading to discomfort, inflammation, and infection. Signs and symptoms. Scooting or dragging the hindquarters along the ground, excessive licking or biting of the anal area, foul odor around the anus, discomfort or pain when sitting, and swelling or redness near the anus. Treatment for anal gland impaction. Treatment for anal gland impaction typically involves manual expression of the glands. The veterinarian may prescribe antibiotics in more severe cases, or if an infection is present. Step 1. Ensure you're in a well-lit, clean area. Have all your supplies ready, including gloves, tissue or paper towels, and a mild cleansing solution. Step 2. It's essential to wear gloves to protect yourself from any bacteria or unpleasant odors. An old t-shirt isn't a bad idea either, as draining anal glands on pets can get messy. Step 3. Have your pet stand or lie down comfortably. You might need someone to help hold your pet steady if they're squirmy. Step 4. The anal glands are located on either side of your pet's anus, at approximately the 4 and 8 o'clock positions. They are small, sac-like structures. Step 5. Gently but firmly, place your thumb and forefinger on either side of the anus, just below the gland openings. Apply gentle pressure towards the anus. You may feel the glands as small, pea-sized bumps. Step 6. Gently squeeze the glands between your thumb and forefinger with steady pressure. Be cautious not to apply too much pressure, which can cause discomfort or injury. Step 7. After expressing the glands, use a mild cleansing solution to clean around the anus. This helps to remove any remaining fluid and reduce the risk of infection. Step 8. Make sure to hygienically dispose of any tissues or paper towels used in the process. Animal bites. What are animal bites? Animal bites in pets refer to injuries inflicted by other animals, whether from another pet, wildlife, or even humans. You can break up the fight with a distraction technique. If it is outside, you can spray both animals with a hose to get them to stop fighting. Signs and symptoms. Visible wounds, pain, discomfort, swelling, redness, inflammation, difficulty eating or drinking, limping or lameness, fever, behavior changes, discharge or pus. Ensure your pet's vaccinations, particularly against rabies, are up to date. Animal bites carry the risk of transmitting diseases, so it's crucial to protect your pet against potential infections. Treatment of animal bites. Seek veterinary care. Regardless of the severity of the bite, it's essential to consult your veterinarian for further assessment and treatment. Secure the area. If the attacking animal is still present, safely remove your pet from the situation to prevent further harm. Make sure both animals are separated to avoid additional injuries. Assess the injury. Examine the bite wound carefully. Look for signs of bleeding, swelling, puncture wounds, or any other visible damage. If the bite has penetrated the skin, cleaning and treating it promptly is essential. Clean the wound. Rinse the wound with clean water to remove any dirt, debris, or bacteria. Use mild soap to cleanse the area around the bite gently. Avoid using hydrogen peroxide or alcohol. Control bleeding. If the wound is bleeding, apply gentle pressure with a clean cloth or gauze pad to stop the bleeding. Elevate the injured area if possible to reduce swelling. Apply antiseptic. Once the wound is clean and dry, apply an antiseptic solution such as chlorhexidine or povidone iodine to help prevent infection. Follow the instructions on the product packaging for proper application. Bandage the wound. Depending on the size and location of the bite, you may need to bandage the wound to protect it from further injury and contamination. Use sterile gauze pads and medical tape to secure the bandage in place. Monitor for signs of infection. Keep a close eye on the bite wound for any signs of infection, such as increased redness, swelling, warmth, pain, or discharge. Contact your veterinarian immediately for further evaluation and treatment if you notice these symptoms. Treatment for snake bites. Remove collars or constrictive items. Remove collars, harnesses, or constrictive items from your pet's neck or body, as swelling can occur rapidly. Do not apply ice or tourniquets. Contrary to popular belief, applying ice or tourniquets to the bite site is not recommended. Do not attempt to suck venom. Do not attempt to suck venom out of the bite wound, as this is ineffective and can introduce bacteria into the wound. Do not give medications. Do not give your pet any medications unless specifically instructed by a veterinarian. Certain medications can worsen the effects of snake venom. Monitor breathing and vital signs. Keep an eye on your pet's breathing and vital signs while transporting them to the veterinary clinic. At the veterinary clinic, treatment for snake bites in pets may include anti-venom administration, pain management, and intravenous fluids to maintain blood pressure and hydration. Arrow wounds. What are arrow wounds? Arrow wounds in pets are injuries caused by arrows or similar projectile objects penetrating the body. These wounds can occur accidentally, such as during hunting activities, or as a result of intentional harm. Do not remove the arrow. You could cut an artery or blood vessel. So leave the arrow in place until you arrive at the vet. Cut off the arrow shaft, so it won't be bumped or jiggled during your trip to the veterinarian. Instead of cutting the shaft flush with your pet's skin, leave a few inches exposed. Treatment for arrow wounds. Immobilize the arrow so that it cannot move. Wrap a clean towel or bubble wrap around it where it enters the skin and bind it with a piece of saran wrap to keep it in place.
Control the bleeding.
Apply direct pressure. If the blood soaks through, put another pad on top first and keep pressure. Keep your pet from moving. If they move, it could make the arrow damage more of their internal tissue. Watch for signs of shock. Cover them with a blanket to keep them warm and put a drop or two of Caro's syrup on their gums. Arrow wounds. What are arrow wounds? Arrow wounds in pets are injuries caused by arrows or similar projectile objects penetrating the body. These wounds can occur accidentally, such as during hunting activities, or as a result of intentional harm. Do not remove the arrow. You could cut an artery or blood vessel. So leave the arrow in place until you arrive at the vet. Cut off the arrow shaft, so it won't be bumped or jiggled during your trip to the veterinarian. Instead of cutting the shaft flush with your pet's skin, leave a few inches exposed. Treatment for arrow wounds. Immobilize the arrow so that it cannot move. Wrap a clean towel or bubble wrap around it where it enters the skin and bind it with a piece of saran wrap to keep it in place.
Control the bleeding.
Apply direct pressure. If the blood soaks through, put another pad on top first and keep pressure. Keep your pet from moving. If they move, it could make the arrow damage more of their internal tissue. Watch for signs of shock. Cover them with a blanket to keep them warm and put a drop or two of Caro's syrup on their gums. Aspiration pneumonia. What is aspiration pneumonia? Aspiration pneumonia in pets is caused by inhaling foreign material, such as food, vomit, or saliva, into the lungs. When foreign material enters the airways and reaches the lungs, it can lead to inflammation, infection, and damage to lung tissue, resulting in aspiration pneumonia. Signs and symptoms: coughing, difficulty breathing, rapid or labored breathing, wheezing, lethargy, fever, loss of appetite, and weakness. In severe cases, pets may exhibit cyanosis, bluish discoloration of the skin and mucous membranes, due to decreased oxygen levels in the blood. Depending on the severity of the condition, treatment may include oxygen therapy to improve oxygenation, intravenous fluids to maintain hydration, antibiotics to control bacterial infection, bronchodilators to alleviate respiratory distress, and supportive care such as nutritional support and rest. Preventing aspiration pneumonia in pets involves minimizing risk factors. This may include feeding pets upright to reduce the risk of regurgitation, managing underlying medical conditions that affect swallowing or esophageal function, and taking precautions during anesthesia or sedation to prevent aspiration. Back injuries. What are back injuries? Back injuries in pets can occur due to a variety of causes, including trauma, degenerative conditions, intervertebral disc disease, IVDD, spinal cord compression, or congenital abnormalities. These injuries can lead to pain, mobility issues, and, in severe cases, paralysis. If your pet has a back injury, getting them to a vet as soon as possible is essential. Signs and symptoms: whining, whimpering, yelping, reluctance to move or difficulty changing positions, limping, favoring one side of the body, or exhibiting stiffness or lameness, muscle spasms or tremors along the spine, and loss of coordination. Treatment for back injuries. Rest. Encourage your pet to rest in a quiet, comfortable area with soft bedding to alleviate pressure on the back. Heat therapy. Applying a warm compress or heating pad to the affected area can help relax muscles and ease discomfort. Pain management. Over-the-counter pain relievers such as acetaminophen or ibuprofen can harm pets and should not be used without veterinary guidance. Your vet may prescribe safe pain medications to help alleviate your pet's discomfort. Bleeding injuries. What is bleeding? External bleeding in pets may result from cuts, lacerations, abrasions, puncture wounds, or injuries caused by accidents, fights, or medical procedures. Signs of external bleeding include blood visible on the skin or fur, dripping or oozing from wounds, and possibly signs of pain or distress from the pet. Signs and symptoms: visible blood, excessive licking or grooming, blood in stool or urine, pale gums, weakness or lethargy, rapid breathing or panting, collapse, agitation or restlessness, and bruising or swelling. Treatment of bleeding. Assess the wound. Determine the cause and severity of the bleeding. You can likely manage it at home if it's a minor cut or scrape. However, if the bleeding is profuse, coming from multiple wounds, or your pet is in distress, seek veterinary care immediately. Apply pressure. Using a clean cloth or gauze pad, apply gentle but firm pressure to the wound to help stop the bleeding. Hold the pressure for a few minutes to allow the blood to clot. Clean the wound. Once the bleeding has stopped, gently clean the wound with mild soap and water or a veterinary antiseptic solution to prevent infection. Be careful not to use hydrogen peroxide or alcohol, which can irritate the tissue. Apply a topical antibiotic. After cleaning the wound, apply a thin layer of antibiotic ointment to help prevent infection and promote healing. Be sure to use products specifically labeled for use in pets. Cover the wound. If it is in an area where your dog can lick or scratch it, cover it with a sterile gauze pad or bandage to protect it and prevent further irritation. Monitor for signs of infection. Keep an eye on the wound for any signs of infection, such as redness, swelling, warmth, discharge, or foul odor. Prevent licking or chewing. If your dog is prone to licking or chewing at wounds, consider using an Elizabethan collar, cone, to prevent them from irritating and disrupting the healing process. Bowel obstruction. What is bowel obstruction? Bowel obstruction in pets, also known as gastrointestinal obstruction, is a condition with a blockage in the digestive tract that prevents the typical passage of food, fluids, and gas. This obstruction can occur in any part of the gastrointestinal tract, including the esophagus, stomach, small intestine, or large intestine. Signs and symptoms: vomiting, diarrhea, abdominal pain or discomfort, loss of appetite, lethargy, dehydration, and, in severe cases, shock. Bowel obstruction is considered a medical emergency and requires immediate veterinary attention. Treatment for bowel obstruction. Do not force feed. If your pet is vomiting, do not offer food or water, which could worsen the obstruction. Allow the gastrointestinal tract to rest. Keep them calm. Stress can exacerbate the symptoms, so try to keep your pet calm and comfortable. Provide a quiet, warm, and familiar environment. Monitor symptoms. Keep a close eye on your pet's symptoms, including vomiting, diarrhea, abdominal pain, lethargy, and changes in behavior. Note down any changes or developments to provide important information to the vet. Prevent dehydration. If your pet is not vomiting excessively, frequently offer small amounts of water to prevent dehydration. You can use a syringe or dropper to administer water slowly if your pet is reluctant to drink. Do not administer medications. Avoid over-the-counter medications or home remedies without consulting a veterinarian. Keep dangerous objects away. If you suspect your pet ingested a foreign object, remove any potential environmental hazards to prevent further ingestion. Remove the object if you can. If something is stuck in their anal passage and you can remove it, then do. Lubricate your gloves to help the object come out when you gently pull at it. If you see a string coming from the anal passage, do not pull it out. It may be embedded inside or wrapped around their tissue. Do not delay veterinary care. While these measures can provide some initial support, they are not a substitute for veterinary treatment. Bowel obstructions can be life-threatening, so it's essential to seek professional help as soon as possible. Canine distemper virus. What is canine distemper virus? Canine distemper is a contagious viral disease that affects domestic dogs and other animals like ferrets, foxes, and certain wildlife species. It is caused by the canine distemper virus, CDV, which belongs to the morbillivirus genus. The virus primarily spreads through respiratory secretions and contact with infected animals. Signs and symptoms: coughing, sneezing, nasal discharge, vomiting, diarrhea, lack of appetite, clear to yellow discharge from the eyes, eye redness and inflammation, fever, thickening of the skin on the nose and foot pads, seizures, tremors, muscle twitches, incoordination, stumbling, and paralysis, severe cases. Treatment for canine distemper virus. Isolation and supportive care. Dogs with distemper should be isolated from other dogs to prevent the spread of the virus. Supportive care measures may include providing a warm, comfortable environment, ensuring adequate nutrition and hydration, and minimizing stress. Fluid therapy. Dehydration is common in dogs with distemper, especially if they have vomiting or diarrhea. Intravenous fluids may be administered to maintain hydration and electrolyte balance. Nutritional support. Dogs with distemper may have reduced appetite or difficulty eating due to oral ulcers or other symptoms. Offering highly palatable and easily digestible foods, such as canned or soft food, may encourage eating. In severe cases, feeding tubes may be necessary to provide adequate nutrition. Antibiotics. Secondary bacterial infections can occur in dogs with distemper due to the virus's impact on the immune system. Antibiotics may be prescribed to treat bacterial infections and prevent complications. Some they use are amoxicillin, ampicillin,
and doxycycline.
Antiviral medications. Although there is no specific antiviral medication for canine distemper, some veterinarians may prescribe medications to help manage symptoms and support the immune response. However, the efficacy of these treatments in combating the distemper virus itself is limited. Symptomatic treatment. Medications may be prescribed to alleviate specific symptoms associated with distemper, such as cough suppressants to reduce coughing, anti-inflammatory drugs to reduce fever and inflammation, and anticonvulsants to control seizures. Canine parvovirus. What is canine parvovirus? Canine parvovirus, CPV, is a highly contagious viral disease that primarily affects puppies and unvaccinated dogs. It attacks rapidly dividing cells, particularly those in the gastrointestinal tract and bone marrow, leading to severe symptoms and potentially fatal complications. Signs and symptoms: loss of appetite, depression, high fever, severe vomiting, diarrhea, often bloody, dehydration, abdominal pain, lethargy and weakness, and secondary infections. If you suspect your dog may have parvovirus, it's crucial to seek veterinary care immediately. Treatment for canine parvovirus. Hospitalization. Dogs with parvovirus often require hospitalization for intensive care, monitoring, and treatment. Hospitalization allows vets to provide round-the-clock care. Fluid therapy. Due to severe diarrhea and vomiting, dehydration is a significant concern in dogs with parvovirus. Intravenous fluids are typically administered to restore hydration and electrolyte balance. Nutritional support. Due to gastrointestinal symptoms, dogs with parvovirus may have reduced appetite or be unable to tolerate oral food and water. Medications. Various medications may be prescribed to manage symptoms and prevent complications associated with parvovirus. These may include antiemetics to control vomiting, antibiotics to treat or prevent secondary bacterial infections, analgesics to alleviate pain and discomfort, and antidiarrheal medications to help manage diarrhea. Antiparvovirus antibodies. Some veterinary clinics offer treatment with antiparvovirus antibodies, also known as hyperimmune plasma or serum, which may help boost the dog's immune response and aid in fighting the virus. Isolation and supportive care. To prevent the spread of the virus, dogs with parvovirus should be isolated from other dogs. Supportive care measures, such as providing a warm, comfortable environment, minimizing stress, and offering gentle handling and reassurance, can help improve the dog's comfort. Monitoring and follow-up. Dogs with parvovirus require close monitoring by veterinary staff to assess their response to treatment, monitor vital signs, and detect any complications early. Follow-up appointments may be scheduled to monitor progress, adjust treatment as needed, and provide care. Carbon monoxide poisoning. What is carbon monoxide poisoning? Carbon monoxide, CO, poisoning in pets occurs when animals inhale excessive amounts of carbon monoxide gas, leading to various symptoms ranging from mild to severe. Carbon monoxide is a colorless, odorless, and tasteless gas produced by incomplete combustion of carbon-containing fuels such as wood, gasoline, natural gas, propane, and coal. Signs and symptoms. Lethargy or weakness, difficulty breathing, bright red mucous membranes, gums, lips, or tongue, vomiting, confusion or disorientation, seizures, collapse, or loss of consciousness. Treatment for carbon monoxide poisoning. Removing the pet from the source of exposure. If possible, move the pet to an area with fresh air to minimize further exposure to carbon monoxide. Providing oxygen therapy. Oxygen therapy may be administered to help increase oxygen levels in the blood and tissues and alleviate symptoms of hypoxia, oxygen deprivation. Supportive care. Pets with carbon monoxide poisoning may require supportive care, such as intravenous fluids to maintain hydration, medications to control seizures or vomiting, and monitoring of vital signs. Cardiopulmonary resuscitation, CPR. What is cardiopulmonary resuscitation? Cardiopulmonary resuscitation, CPR, for cats and dogs is a life-saving emergency procedure used to restore circulation and breathing in animals experiencing cardiac or respiratory arrest. Assessment. First, assess the animal's consciousness and breathing. If the animal is unresponsive and not breathing normally, CPR is necessary. Check for responsiveness. Gently shake the animal and call its name to see if it responds. If there's no response, gently tap its shoulder or rub its chest to see if it reacts. How to perform pet CPR.
Clear airway.
If the animal is unconscious, gently extend its head and neck to open the airway and remove any obstructions. Check breathing. Look, listen, and feel for breathing. Place your ear near the animal's mouth and nose. Watch for chest movement, and feel for breath on your cheek. Perform chest compressions. Place the animal on its right side on a firm surface. For cats and small dogs, compress the chest by pressing down with the palm of your hand over the ribcage. For larger dogs, you may need to use both hands. Compress the chest about 1/4 to 1/3 its width at about 100 to 120 compressions per minute. Provide artificial respiration. After every 30 chest compressions, give 2 rescue breaths. Close the animal's mouth and firmly seal its lips, then blow into its nose until you see the chest rise. Continue chest compressions and rescue breaths in a cycle. Check for signs of recovery. Periodically check for signs of consciousness and normal breathing. If the animal starts breathing or shows signs of recovery, stop CPR but continue to monitor until veterinary help arrives. Remember, CPR for pets is a temporary measure to sustain life until professional veterinary care can be provided.
Chemical burns.
What are chemical burns? Chemical burns in pets occur when a corrosive substance comes into contact with the animal's skin or mucous membranes, causing tissue damage. Common substances that can cause chemical burns in pets include cleaning products, bleach, ammonia, drain cleaners, and oven cleaners. Pine sol is toxic to all animals. Automotive fluids, antifreeze, brake fluid, and battery acid. Lawn and garden chemicals, fertilizers, pesticides, and herbicides. Pool chemicals, like chlorine and bromine. Treatment of chemical burns. Signs and symptoms. Redness, swelling, or blistering of the affected area, pain or discomfort, licking, chewing, scratching, hair loss or skin discoloration, ulceration or necrosis. Flushing the affected area. If the substance is still present on the skin or fur, flushing it with copious amounts of water can help dilute and remove the chemical. Use lukewarm water and avoid rubbing the area, which can further irritate the skin. Seeking veterinary care. Even if the initial symptoms appear mild, seeking veterinary attention is essential. Pain management. Pain relief medications may be prescribed to alleviate discomfort and reduce inflammation. Wound care. Depending on the severity of the burn, the vet may recommend topical treatments, bandaging, or other wound care techniques to promote healing and prevent infection.
Supportive care.
In severe cases where the pet has ingested or inhaled a toxic substance, supportive care such as intravenous fluids, respiratory support, or antidotes may be necessary. Remove your pet's collar. Chemical burns can swell up the skin. Safety for chemical burns. Protect your skin and eyes. Wear disposable gloves and glasses. If your pet shakes, the chemical will go everywhere. Muzzle them if needed. If a pet is in pain, they may bite by reflex. To help them, you may have to muzzle a dog. If you do not have a muzzle, you can make one out of a necktie or pantyhose. For small dogs or cats, you can slip a pillowcase over their head. Do not do either if there are problems breathing.
Chemical poisoning.
What is chemical poisoning? Swallowed chemical poisoning in pets occurs when animals ingest substances that are toxic to their bodies. Common household chemicals, such as cleaning products, pesticides, medications, and certain plants, can pose significant risks to pets if ingested. Signs and symptoms. Vomiting, diarrhea, drooling, difficulty breathing, seizures, weakness, lethargy, and collapse. If you suspect your pet has ingested a toxic substance, it's essential to seek veterinary care immediately. Types of chemical poisoning. Antifreeze. Antifreeze can be extremely dangerous to dogs. It can damage their kidneys and can cause death, even after only a tiny amount. Kidney failure will start to show in 2 to 3 days. Cocoa mulch. Cocoa bean mulch contains theobromine and caffeine, like chocolate. These chemicals are poisonous to dogs, even if only used as an outdoor mulch solution for your yard. Fabric softener sheets. Fabric softeners contain detergent and are unsafe for dogs. Unfortunately, these chemicals can harm your pet if they chew on or ingest a sheet, even a used one. Coconut and coconut oil. When ingested in small amounts, coconut and coconut-based products are not likely to cause serious harm to your pet. The flesh and milk of fresh coconuts do contain oils that may cause stomach upset, loose stools, or diarrhea. Ice melts. The most common issue seen when a pet ingests ice melts is stomach upset, vomiting, and diarrhea. In some cases, vomiting or diarrhea can be severe and cause concern for dehydration. Mothballs. The most toxic commonly found mothball ingredient is camphor. Camphor ingestion results in central nervous system poisoning, where a dog can become agitated and develop seizures. Insecticides and pesticides. Most pesticides or insecticides, typically those that come in a spray can, are primary irritants to dogs and cats and result in drooling, nausea, vomiting, and diarrhea. These should never be where a pet can grab them. Lawn fertilizer and weed killer. Many over-the-counter weed killers contain glyphosate, an herbicide linked to cancer in humans and dogs. If your dog starts to foam at the mouth, has difficulty breathing, or develops a rash after contacting weed killers or other chemicals like insecticides, contact your vet. Rat bait. The chemicals used in these products are often highly toxic to dogs and can cause internal bleeding, kidney failure, organ damage, and even death if eaten by your dog. Liquid potpourri. Many liquid potpourri products and essential oils, including oil of cinnamon, citrus, pennyroyal, peppermint, pine, sweet birch, tea tree, melaleuca, wintergreen, and ylang ylang, are poisonous to dogs. Play-Doh. While non-toxic, non-irritating, and non-allergenic, Play-Doh can harm pets if ingested due to the high salt content. Too much salt is dangerous for dogs, and sodium toxicosis can occur when dogs ingest salt. Salt dough. Salt dough for Christmas ornaments are just as bad, if not worse, than Play-Doh. Symptoms of salt toxicosis include vomiting, diarrhea, and drunk walking, as well as seizures, coma, or death.
Chemicals on skin.
If your pet has poison on their skin, bath them. For paint, tar, and motor oil, rub it in vegetable oil before it hardens. Then use cornstarch to absorb the toxins and wash them with dish washing liquid. Treatment: chemical poisoning. Do not induce vomiting. If your pet swallows a caustic poison such as bleach, ammonia, or petroleum products like kerosene and motor oil, do not induce vomiting. It burns your pet's throat on the way down and up. Soak a piece of bread in vegetable oil and feed it to your pet to help coat their stomach lining, then take them to the vet. Give activated charcoal. For antifreeze, baker's chocolate, coal tar products, flea products, lead products, pest bait, or other products, give your pet activated charcoal.
Choking.
What is choking? Choking in pets occurs when there is an obstruction in their airway, preventing them from breathing normally. This obstruction can be partial or complete and may result from various causes, including swallowing foreign objects. Pets, especially dogs and cats, may ingest objects such as toys, bones, strings, etc. Chewing on objects. Pets may chew on items that can break apart and cause choking hazards, such as sticks, balls, or pieces of rawhide. Eating too quickly. Some pets may need to chew correctly to gulp their food or treats. Treatment for choking. Signs and symptoms. Difficulty breathing or noisy breathing, coughing, gagging or retching, pawing at the mouth or neck, bluish or pale gums and tongue, panicked behavior, or agitation. Assess the situation. If your pet is conscious and struggling to breathe, try to determine the location and nature of the obstruction. Be cautious when handling your pet, as they may be frightened or in pain. Check the mouth. If you can see the object blocking the airway and it's safe to do so, try removing it using your fingers or tweezers. Perform a modified Heimlich maneuver. For dogs, stand behind your pet and wrap your arms around their abdomen just below the ribcage. Place a fist with one hand against your pet's abdomen. Use your other hand to apply firm, upward pressure in a quick thrusting motion. You can perform a similar maneuver for cats by placing your hands on either side of their ribcage and applying quick, gentle pressure. Seek veterinary care. Even if you successfully dislodge the obstruction, a veterinarian must examine your pet to ensure there are no further complications or injuries. Clothing dryer injuries. What are clothing dryer injuries? Cats love heat, and they seek it out wherever they can. Clothing dryer injuries in cats can occur when a cat enters a clothes dryer and the appliance is turned on. Unfortunately, such incidents can lead to severe injuries or even fatalities for the cat. Signs and symptoms. Visible injuries, pain, discomfort, difficulty breathing, lethargy, weakness, appetite changes, aggression, hiding, avoidance, excessive grooming, visible burns or scalds, and shock in severe cases. If you suspect heat stroke, put cool water under places where they do not have much fur, like their armpits, stomach, and ears. Treatment for clothing dryer injuries. Assess the situation. Carefully evaluate your cat's condition and look for any visible injuries or signs of distress. If your cat is in severe pain or appears in critical condition, immediately contact your veterinarian or an emergency veterinary clinic for guidance. Remove the cat from the dryer. If it is still inside, carefully remove it as quickly and gently as possible. Take care to support your cat's body and avoid causing further injury. Check for apparent injuries. Once your cat is out of the dryer, carefully examine its body for any visible signs of trauma, such as burns, cuts, or bruises. Cooling burns. If your cat has suffered thermal burns from the dryer, gently cool the affected areas with cool water or a cold compress to help relieve pain and reduce inflammation. Avoid ice or very cold water, which can further damage the skin. Stabilize the cat. Keep your cat calm and comfortable while awaiting veterinary care. Provide a quiet, warm, and secure environment, and avoid handling the cat more than necessary. Limit movement. Encourage your cat to rest and avoid excessive movement, especially if it appears to be in pain or has sustained musculoskeletal injuries. Coccidioidomycosis. Valley fever. What is coccidioidomycosis? Coccidioidomycosis, also known as valley fever, is a fungal disease caused by the inhalation of spores of the fungus Coccidioides mitis or Coccidioides posataceae. This disease primarily affects humans and animals in arid regions of the southwestern United States, Central America, and South America. While dogs are more commonly affected than cats, both species can develop valley fever. Signs and symptoms: coughing, difficulty breathing, labored breathing, fever, lethargy and weakness, weight loss, joint pain and lameness, skin lesions, uveitis, inflammation of the uvea, and conjunctivitis, inflammation of the conjunctiva. Treatment for coccidioidomycosis. Antifungal medications. Antifungal drugs are the primary treatment for coccidioidomycosis in cats and dogs. The most commonly used antifungal agents include azoles such as fluconazole, itraconazole, and voriconazole. Long-term medication. Treatment with antifungal medications typically requires long-term administration, often for several months or even years, depending on the severity of the infection. It's important to follow your veterinarian's instructions regarding the dosage, frequency, and duration of medication to ensure optimal efficacy and minimize the risk of recurrence. Environmental management. Since coccidioidomycosis is caused by inhalation of fungal spores present in the environment, it's essential to minimize exposure to contaminated soil or dust in areas where the fungus is endemic. This may involve keeping cats and dogs indoors during dusty conditions and avoiding areas with high concentrations of fungal spores. Preventive measures. Prevention of coccidioidomycosis in cats and dogs primarily involves minimizing exposure to the fungus by avoiding outdoor activities in endemic areas during windy or dusty conditions. Vaccination against coccidioidomycosis is not currently available for cats and dogs. Coccidiosis, coccidia. What is coccidiosis? Coccidia in dogs refers to a group of microscopic parasites that can infect the intestines of dogs and other animals. The most common types of coccidia that affect dogs belong to the genus Isospora. Isospora canis and Isospora ohioensis are coccidia that can cause dog infections. Signs and symptoms: diarrhea, weight loss, dehydration, loss of appetite, vomiting, abdominal discomfort, lethargy, and weakness. Young puppies and dogs with weakened immune systems are at higher risk of developing severe disease and may experience more severe symptoms. Treatment for coccidiosis. Anticoccidial medications. The primary treatment for coccidiosis in dogs is the administration of anticoccidial medicines to eliminate the coccidia parasites from the dog's gastrointestinal tract. The most commonly used anticoccidial drugs for dogs include sulfatamethoxine, trimethoprim sulfa combinations, amprolium, and toltrazuril. Antibiotics. In some cases, antibiotics may be prescribed to treat or prevent secondary bacterial infections in dogs with coccidiosis, especially if there is evidence of concurrent bacterial diarrhea or inflammation of the intestinal lining. Fluid therapy. Dogs with coccidiosis often experience dehydration due to diarrhea and decreased fluid intake. Intravenous or subcutaneous fluid therapy may be necessary to restore hydration and electrolyte balance, especially in cases of severe dehydration or dehydration in young puppies. Nutritional support. Maintaining adequate nutrition is essential for dogs with coccidiosis to support the immune system and promote recovery. Providing a highly digestible diet, such as a bland diet of boiled chicken and rice or a commercial prescription diet formulated for gastrointestinal health, may help. Drowning. What is drowning? Drowning is a form of suffocation that occurs when someone is submerged in water or another liquid, leading to respiratory impairment. It happens when the airway becomes blocked by water, preventing the pet from breathing correctly. Signs and symptoms. Limp or unresponsive body in the water, coughing or gagging after being in the water, weakness or lethargy, bluish or pale gums, and loss of consciousness. Remove from water. Carefully remove your pet from the water as quickly as possible, supporting their head and neck if they're unconscious. Check for breathing. Check if your pet is breathing. Look for chest movements, listen for breath sounds, and feel for airflow near their nose or mouth.
Clear airway.
If water is in your pet's airway, carefully tilt their head back and try to clear any water or debris from their mouth and throat. Keep warm. Wrap your pet in a warm blanket or towel to help maintain their body temperature. Pets lose heat quickly when wet, and hypothermia can be a concern. Electrical shock. What is electrical shock? Electrical shock in pets can occur when they come into contact with live electrical currents, such as exposed wires, faulty appliances, or damaged electrical cords. This can lead to severe injuries or even death. Signs and symptoms. Burns or singed fur around the area of contact, difficulty breathing, irregular heartbeat or cardiac arrest, muscle tremors or seizures, loss of consciousness, weakness or lethargy, pawing at the mouth or face, pain or sensitivity when touched, and unresponsiveness. Treatment for electrical shock. Ensure safety. Before approaching your pet, ensure that the area is safe and that there are no ongoing electrical hazards. Check for breathing and pulse. Assess your pet's breathing and pulse. If they're not breathing or do not have a pulse, begin CPR immediately. Remove from the electrical source. Carefully disconnect the power source or remove your pet from the source of electricity using a non-conductive object, such as a wooden stick or rubber gloves. Check for injuries. Assess your pet for any visible burns, wounds, or signs of trauma. Be cautious, as electrical shock injuries may not be immediately apparent but could be severe internally. Keep warm. Wrap your pet in a blanket or towel to help maintain their body temperature. Transport to the vet. Even if your pet seems to recover, it's crucial to seek veterinary care as soon as possible. Electrical shock can cause internal injuries and complications that may not be immediately apparent. Eye injuries. What are eye injuries? Eye injuries in pets can occur due to various reasons, ranging from trauma to infection. Some common eye injuries in pets include scratches or abrasions, corneal ulcers, conjunctivitis, foreign bodies, trauma, chemical burns, glaucoma, entropion or ectropion, uveitis, and tumors. Signs and symptoms. Squinting, excessive blinking, redness, watery or discolored discharge, swelling around the eye or eyelids, cloudiness or opacity, rubbing or pawing, visible injuries, decreased appetite, lethargy, sensitivity to light, and changes in pupil size such as anisocoria or miosis. Treatment for eye injuries. Flush the eye. Use a sterile saline solution or a mild eye wash recommended by your veterinarian to gently flush any debris or irritants from your pet's eye. You can do this by gently squirting the solution onto the eye or using a clean cloth to wipe away discharge or debris. Apply a warm compress. A warm, damp cloth applied gently to the affected eye can help soothe irritation and reduce swelling. Hold the compress against the eye for a few minutes several times daily. Protect the eye. If your pet tends to paw or rub at the affected eye, consider using an Elizabethan collar, cone collar. Major injury. If an eye is out of the socket, the pet must be taken to the vet. The easiest way to keep the eye moist is to spray it with saline solution. Try to get to the vet within an hour because the tissue behind the eye starts swelling quickly. Monitor closely. Keep a close eye on your pet's symptoms and behavior. If you notice any worsening or persistent symptoms, seek veterinary care promptly. Fish hook injuries. What are fish hook injuries? A fish hook injury in pets occurs when a pet, typically a dog, cat, or sometimes a bird, comes into contact with a fishing hook. This often happens when a pet ingests bait with a hook attached or gets hooked externally while exploring or playing near fishing gear. Fish hook injuries can vary in severity depending on the size of the hook, its location, and whether any barbs are present. Signs and symptoms. Pain, swelling, bleeding, difficulty eating or swallowing, and visible signs of the hook lodged in the mouth, throat, or elsewhere on the body. Treatment for fish hook injuries. Assess the situation. Determine the severity of the injury and whether the hook is embedded in the pet's skin, mouth, or throat. Minimize movement. Encourage the pet to remain calm and still to prevent the hook from causing further damage as you assess the situation and decide on a course of action. Control bleeding. If bleeding is associated with the injury, apply gentle pressure to the area with a clean cloth or bandage to help control the bleeding. Avoid applying excessive pressure that could cause additional pain or discomfort. Evaluate the hook. Carefully examine it to determine its size, shape, and location in the pet's body. Suppose the hook is superficially lodged in the skin and not profoundly embedded. In that case, you may attempt to remove it using specialized tools such as wire cutters or pliers, ensuring to protect yourself from injury in the process. Seek assistance. If you need help with how to proceed or if the hook is deeply embedded or located in a sensitive area such as the mouth or throat, seek assistance from a veterinarian or animal rescue organization as soon as possible.
Fleas.
What are fleas? Fleas are small, wingless insects that feed on the blood of mammals and birds. They belong to the order Siphonaptera and are known for their ability to jump long distances relative to their size. Fleas are ectoparasites, meaning they live externally on the bodies of their hosts, including dogs, cats, humans, and various other animals. Signs and symptoms. Excessive scratching, licking, biting, visible fleas or flea dirt, hair loss or hot spots, allergic reactions, restlessness, and discomfort. You must take prompt action if you notice any of these signs or symptoms in your pet. Treatment for fleas. Flea control products. Various topical treatments and oral medications are available that effectively kill fleas and prevent infestations. These products contain active ingredients such as imidacloprid, fipronil, selamectin, spinosad, or fluorolanur, targeting fleas at different life cycle stages. Environmental control. Vacuuming carpets, rugs, and furniture regularly can help remove flea eggs, larvae, and pupae. Washing pet bedding, blankets, and other fabrics in hot water can also kill fleas and their eggs. Regular grooming. Regular grooming can help remove adult fleas, flea dirt, and eggs from your pet's fur. Use a fine-toothed flea comb to comb through your pet's fur, especially in areas where fleas commonly hide, such as the neck, back, and tail. Consultation with a veterinarian. If your pet is experiencing severe itching, skin irritation, or other symptoms associated with flea infestation, or if over-the-counter flea control products are ineffective, consult with your veterinarian for guidance and treatment options. Food poisoning. What is food poisoning? Food poisoning in pets refers to ingesting contaminated or spoiled food that leads to gastrointestinal upset or other adverse effects on the pet's health. Pets, including dogs and cats, can suffer from food poisoning if they consume food contaminated with bacteria, toxins, molds, or other harmful substances. Common sources of food poisoning in pets include raw or undercooked meat, spoiled or moldy food, table scraps containing bones or fatty foods, certain human foods that are toxic to pets, such as chocolate, onions, grapes, and raisins, and improperly stored pet food. Types of food poisoning. Signs and symptoms. Vomiting, diarrhea, lethargy, loss of appetite, abdominal pain, drooling, dehydration, and, in severe cases, tremors, seizures, or collapse. Coffee, tea, and other caffeine. Keep your dog away from cocoa, chocolate, colas, and energy drinks. Onions, garlic, and chives. The onion family, whether dry, raw, or cooked, is toxic to dogs and can cause tummy irritation. Chocolate. Chocolate contains a stimulant called theobromine, which is toxic to dogs and can cause kidney failure. Macadamia nuts. Macadamia nuts contain a toxin that can affect your dog's muscles and nervous system, resulting in weakness, swollen limbs, and panting. Corn on the cob. Corn on the cob could be fatal if eaten by your dog. The cob can cause a blockage in your dog's intestine. Avocado. Avocados are another poisonous food for dogs. Avocado plants contain persin in their leaves, fruit, and seeds and can cause vomiting and diarrhea in dogs. Artificial sweetener, xylitol. Chewing gum and sugar-free products, including some peanut butters, are often laced with an artificial sweetener called xylitol, which causes an insulin release. However, if your dog digests one of these, they can go into hypoglycemia, which is linked to liver failure and blood clotting disorders. Alcohol. Alcohol has a significant impact on dogs, even in small doses. The drink not only causes intoxication as it does in humans, but it can lead to sickness, diarrhea, and even central nervous system damage. Dairy products. Milk and milk-based products can cause diarrhea and other digestive problems for your pup. Cooked bones. Giving your dog a raw, uncooked bone to chew on is excellent, but avoid cooked bones at all cost. These can easily splinter and in large quantities cause constipation or, at worst, a perforation of the gut, which can be fatal. Salt and sugar. Sodium ion poisoning with salt and diabetes with sugar. Grapes and raisins. The ingredient that causes the toxin is unknown. However, grapes and raisins may cause severe liver damage and kidney failure. Raw eggs. Causes food poisoning like Salmonella or E. coli. Persimmons, peaches, and plums. Seeds from persimmons can cause problems in a dog's small intestine. They can also block their intestines. That can also happen if a dog eats the pit from a peach or plum. Peach and plum pits also have cyanide, which is poisonous to people and dogs. Raw meat and fish. Like raw eggs, raw meat and fish can have bacteria that cause food poisoning. Some fish, such as salmon, trout, shad, or sturgeon, can also have a parasite that causes fish disease or salmon poisoning disease. Thoroughly cook the fish to kill the parasite. Yeast dough. Bread dough needs to rise before it's baked. And that's precisely what it would do in your dog's stomach if they ate it. As it swells inside, the dough can stretch your dog's abdomen and cause a lot of pain. Banana peels. Banana peels aren't toxic, but more challenging to break down because they contain a lot of fiber. If your dog eats a banana peel, it may cause an upset stomach, which can lead to vomiting and diarrhea. Preventing food poisoning in pets involves feeding them a balanced diet formulated for their specific nutritional needs, avoiding feeding them table scraps or foods that are toxic to pets, storing pet food properly to prevent contamination, and being cautious when introducing new foods or treats. Friction burns. What are friction burns? Friction burns in pets occur when the skin is rubbed against a surface repeatedly or with significant force. Road rash. Pets, particularly dogs, may experience friction burns when they run or slide across rough surfaces, such as asphalt or concrete. Abrasion from rough surfaces. Pets may develop friction burns from rubbing against rough or abrasive surfaces, such as carpets, rough terrain, or abrasive materials. Rope or leash burns. Friction burns can occur if a pet's skin comes into contact with a rope or leash and is pulled or dragged along a surface. Treatment for friction burns. Signs and symptoms. Redness, swelling or inflammation, pain or discomfort, licking, chewing or scratching, skin abrasions or raw patches, hair loss or thinning of the fur, bleeding or oozing of fluid from the wound. Cleaning the wound. Clean the affected area with a mild antiseptic solution or sterile saline to remove dirt, debris, and bacteria. Remove larger particles with tweezers or pliers. Applying topical treatments. Depending on the severity of the burn, the vet may recommend a soothing topical ointment or spray to promote healing and reduce inflammation. In severe cases, or if the friction burn becomes infected, veterinary care may be needed to provide advanced wound care, antibiotics, or other treatments to facilitate healing. Protecting the wound. Cover the friction burn with a sterile dressing or bandage to protect it from further irritation and prevent contamination. Change the bandage regularly. Preventing further injury. Take steps to prevent your pet from licking, chewing, or scratching at the wound, which can delay healing and increase the risk of infection. Elizabethan collars or other protective devices may be necessary to prevent self-trauma. Gastric dilatation and volvulus. Bloat. What is bloat? Gastric dilatation and volvulus, GDV, commonly known as bloat, is a life-threatening condition in dogs characterized by the rapid expansion of the stomach followed by its abnormal rotation or twisting. This condition primarily affects large, deep-chested breeds, such as Great Danes, Doberman Pinschers, and German Shepherds, although it can occur in any breed. Signs and symptoms. Abdominal distension. Unproductive attempts to vomit, restlessness, pacing, salivation, panting, weakness, collapse, and signs of shock. Treatment for bloat. Contact veterinary care. Even if you suspect bloat, you must immediately contact your veterinarian or emergency veterinary clinic for guidance and to inform them of the situation. Minimize activity. Encourage your dog to lie down and rest quietly. Restrict their movement to prevent further stress or exertion. Limit water intake. While keeping your dog hydrated is essential, restricting water intake can help prevent further stomach distension. Offer small sips of water if your dog is thirsty, but avoid allowing them to drink large amounts. Do not feed. Refrain from offering any food to your dog, as this can exacerbate the bloating and increase the risk of stomach twisting. Monitor vital signs. Keep an eye on your dog's vital signs, such as breathing rate, heart rate, and gum color. If you notice any signs of shock, such as pale gums or rapid breathing, seek emergency veterinary care immediately. Transport safely. When transporting your dog to the vet, handle them gently and securely. Avoid any sudden movements or jostling that could worsen their condition. Heat burns. What are heat burns? Heat burns in pets occur when the skin comes into contact with a heat source, causing damage to the tissues. Contact with hot surfaces. Pets may experience heat burns if they walk or lie on surfaces heated by the sun or other heat sources, such as asphalt, concrete, metal, or hot stovetops. Scalding from hot liquids. Pets may suffer heat burns if they come into contact with hot liquids, such as boiling water. Flames or fire. Pets may sustain heat burns if exposed to flames from a fire or candles. Sunburn. Pets with light-colored or thin fur and those with little hair or exposed skin are at risk of sunburn. Treatment for heat burns. Signs and symptoms. Redness, swelling, blistering, pain or discomfort, licking, chewing, or scratching, skin damage, including peeling, charring, or skin sloughing, hair loss or discoloration, rapid breathing, pale gums, or weakness. Cooling the burn. Immediately cool the burned area with cool water or a cold compress to help reduce pain and inflammation. Avoid ice or very cold water, which can further damage the skin. Cleaning the wound. Clean the burned area with a mild antiseptic solution or sterile saline to remove dirt, debris, and bacteria. Applying topical treatments. Depending on the severity of the burn, the vet may recommend a soothing topical ointment or spray to promote healing and reduce inflammation. Protecting the wound. Cover the burn with a sterile dressing or bandage to protect it from further injury and prevent contamination. Pain management. Pain relief medications may be prescribed to alleviate discomfort and improve the pet's quality of life during the healing process. Heat stroke. What is heat stroke? Heat stroke in pets occurs when their body temperature rises dangerously high due to prolonged exposure to hot and humid conditions. Heat stroke can occur when pets are left in parked cars, confined in poorly ventilated spaces, or exposed to intense sun and heat for extended periods. Signs and symptoms: excessive panting, drooling, rapid heartbeat, weakness, vomiting, diarrhea, collapse, and seizures. If left untreated, heat stroke can lead to organ failure, coma, and death. Immediate action is crucial if you suspect your pet is suffering from heat stroke. Treatment for heat stroke. Move to a cooler area. Immediately move your pet to a cooler, shaded area away from direct sunlight or heat sources. Cool with water. Use cool, not cold, water to wet your pet's fur, focusing on areas with less fur, such as the belly and inner thighs. You can use a hose, wet towels, or immerse your pet in a bathtub of cool water if they're small enough. Fan or provide airflow. Use a fan or create airflow with a breeze to help evaporate moisture from your pet's wet fur, aiding in the cooling process. Offer water. Encourage your pet to drink cool water to help rehydrate. Do not force them to drink, but make water available. Monitor temperature. Use a rectal thermometer to monitor your pet's temperature. Stop cooling once their temperature reaches around 103 degrees Fahrenheit 39.4 degrees Celsius to avoid overcooling. Avoid ice-cold water or ice packs. While it may seem intuitive to use ice-cold water or ice packs, extreme cold can constrict blood vessels and prevent heat dissipation, potentially exacerbating the situation. Do not cover your pet. It's important to keep your pet cool during hot weather, but covering them with towels or blankets is not recommended. This is because it can trap heat and prevent them from cooling down properly. Instead, provide your pet with plenty of cool water and a shaded area to rest in. Seek veterinary care. Even if your pet's condition appears to improve with home treatment, it's crucial to seek veterinary attention immediately. Heat stroke can cause internal damage and complications that may not be immediately apparent.
Hypothermia.
What is hypothermia? Hypothermia in pets occurs when their body temperature drops below normal levels, usually due to exposure to cold temperatures, wet conditions, or prolonged immersion in cold water. Dogs, cats, and other animals can be at risk of hypothermia, especially during winter or cold environments. Signs and symptoms: shivering, lethargy, weakness, pale or cold skin, slow breathing or heartbeat, and disorientation. In severe cases, hypothermia can lead to unconsciousness, organ failure, and death. Treatment for hypothermia. Move to a warm area. Bring your pet indoors or to a warmer environment away from cold and wet conditions. Wrap in blankets. Cover your pet with dry blankets or towels to help retain body heat. You can also use your body heat by snuggling with your pet under the blankets. Warm up gradually. Avoid using direct heat sources like heating pads, hair dryers, or hot water bottles, as these can cause burns, especially if your pet's circulation is compromised. Instead, opt for gentle warming methods such as warm, dry towels. Monitor temperature. Use a rectal thermometer to monitor your pet's temperature. The average body temperature for dogs and cats is around 100 to 102.5 degrees Fahrenheit, 37.8 to 39.2 degrees Celsius. Provide warm fluids. Offer your pet small amounts of warm water to drink if they are conscious and able to swallow. This can help rehydrate them and aid in warming their body. Handle gently. Handle your pet gently and avoid rough movements, as their muscles may be stiff and their coordination impaired due to hypothermia. Kennel cough. What is kennel cough? Kennel cough, also known as canine infectious tracheobronchitis, is a highly contagious respiratory disease in dogs. It is characterized by inflammation of the trachea and bronchi, leading to a persistent cough. The causes of kennel cough are Bordetella bronchoseptica, canine parainfluenza virus, canine adenovirus type 2, and Mycoplasma spp. Signs and symptoms: dry cough, coughing fits, gagging or retching, nasal discharge, slight fever, lethargy, loss of appetite, and mild respiratory distress. Treatments for kennel cough. Rest. Rest is essential for dogs with kennel cough to allow their bodies to recover and heal. Avoid strenuous exercise or activities that may exacerbate coughing episodes. Cough suppressants. Cough suppressants may be prescribed to help reduce the frequency and severity of coughing episodes, especially if the coughing is persistent or causing discomfort for the dog. However, cough suppressants should be used judiciously and under veterinary guidance, as coughing plays an important role in clearing the airways of mucus and debris. Antibiotics. While kennel cough is typically caused by viruses, bacterial infections can sometimes occur as secondary complications. In such cases, antibiotics may be prescribed to treat or prevent bacterial infections and reduce the risk of complications. Anti-inflammatory medications. Non-steroidal anti-inflammatory drugs, NSAIDs, or corticosteroids may be prescribed to reduce inflammation and discomfort associated with kennel cough. These medications can help alleviate symptoms such as throat irritation, nasal congestion, and fever. Leptospirosis. What is leptospirosis? Leptospirosis is a bacterial infection caused by the Leptospirus species of bacteria. This disease affects humans and animals and is often transmitted through the urine of infected animals, which can contaminate water, soil, or food. Signs and symptoms. Fever, vomiting, diarrhea, muscle pain and stiffness, lethargy, loss of appetite, jaundice, increased thirst, increased urination, and difficulty breathing. The primary treatment for leptospirosis in both humans and animals, including dogs, is the administration of antibiotics. Lyme disease. What is Lyme disease? Lyme disease in dogs, also known as canine Lyme borreliosis, is a bacterial infection caused by the spirochete bacterium Borrelia burgdorferi. This disease is transmitted through the bite of infected black-legged ticks, commonly called deer ticks. Signs and symptoms. Lameness, swollen joints, fever, lethargy, loss of appetite, difficulty breathing, increased urination, and kidney problems. If you suspect your dog has Lyme disease, it's crucial to consult with a veterinarian for proper diagnosis and treatment. Treatment for Lyme disease. Antibiotics. The most common antibiotic used is doxycycline. Duration of treatment varies, but often lasts several weeks. Supportive care. Pain relievers and anti-inflammatory medications may be prescribed. Rest is often recommended to help manage symptoms. Preventative measures. Tick control measures, such as tick prevention products, are essential. Regular tick checks and avoiding areas where ticks are prevalent help reduce the risk of infection. Nail injuries. What is nail injuries? Nail damage in pets refers to injuries or abnormalities affecting the nails or claws of animals, such as dogs and cats. This can include a range of issues, including broken nails, ingrown nails, split nails, overgrown nails, infections, nail bed injuries,
Brittle or weak nails.
signs and symptoms. Limping or favoring a paw, visible bleeding, swelling and redness around the nail bed, excessive licking or chewing at the affected nail, changes in gait or posture, signs of pain or sensitivity when the nail is touched, visible abnormalities such as a broken or split nail. Treatment of nail injuries. Clean the wound. If there's visible bleeding, gently clean the area around the nail with a clean cloth or gauze pad soaked in mild antiseptic solution or saline water. Trim the damaged nail. If the nail is broken or split, you can carefully trim any loose or jagged edges using pet nail clippers. Be cautious not to cut into the quick, sensitive part of the nail. Apply styptic powder. If bleeding persists after trimming the nail, apply styptic powder or a styptic pencil to the tip of the nail to help stop the bleeding. Keep the wound clean and dry. After cleaning and trimming the nail, monitor the area for signs of infection, such as increased redness, swelling, or discharge. Keep the wound clean and dry, and avoid letting your pet lick or chew the area. Prevent further trauma. Consider placing a protective bootie or bandage over the injured paw to prevent further trauma or irritation to the damaged nail. Ensure the bandage is not too tight and doesn't restrict circulation. Encourage rest. Encourage your pet to rest and limit physical activity to prevent further injury to the affected nail.
Plant poisoning.
What is plant poisoning? Plant poisoning in pets occurs when animals ingest toxic plants, adversely affecting their health. Many typical household and garden plants can be toxic to pets if ingested, including lilies, azaleas, rhododendrons, tulips, daffodils, oleander, sago palm, philodendron, dieffenbachia, and many more. Signs and symptoms: vomiting, diarrhea, drooling, lethargy, weakness, difficulty breathing, tremors, seizures, and in severe cases, organ failure or death. Types of plant poisoning. Marijuana. Ingestion of cannabis by pets can result in depression of the central nervous system and coordination problems, as well as vomiting, diarrhea, drooling, increased heart rate, and even seizures and coma. Sago palm. All plant parts are poisonous, but the seeds or nuts contain the most significant toxin. The ingestion of just 1 or 2 seeds can result in very serious effects, which include vomiting, diarrhea, depression, seizures, and liver failure. Lilies. Lilies are considered to be highly toxic to cats. Even ingestions of very small amounts of the plant can cause severe kidney damage. Tulips. The bulb portions of tulips contain toxins that can cause intense gastrointestinal irritation, drooling, loss of appetite, depression of the central nervous system, convulsions, and cardiac abnormalities. Oleander. All parts of the oleander are considered to be toxic and can cause serious effects that include gastrointestinal tract irritation, abnormal heart function, hypothermia, and even death. Azalea/rhododendron. The azalea plant contains substances known as grantoxins, which can produce vomiting, drooling, diarrhea, weakness, and depression of the central nervous system. Castor bean. The poison in castor beans is ricin, a highly toxic protein that can produce abdominal pain, drooling, vomiting, diarrhea, excessive thirst, weakness, and loss of appetite. Amaryllis. Amaryllis contains toxins that can cause vomiting, depression, diarrhea, abdominal pain, hypersalivation, anorexia, and tremors. Cyclamen. The cyclamen plant contains cyclamine, but the highest concentration of this toxic component is typically located in the root portion of the plant. If consumed, cyclamen can produce significant gastrointestinal irritation, including intense vomiting and even death. Yew. The yew plant contains a toxic component known as taxine, which causes central nervous system effects such as trembling, coordination problems, and difficulty breathing. It can also cause significant gastrointestinal irritation and cardiac failure. Autumn crocus. Ingestion of autumn crocus by pets can result in mouth irritation, bloody vomiting, diarrhea, shock, multi-organ damage, and bone marrow suppression. Chrysanthemum. These popular blooms contain pyrethrins. If ingested, they may produce gastrointestinal upset, including drooling, vomiting, and diarrhea. In some instances, depression and loss of coordination may also develop if enough is consumed. English ivy. Also called branching ivy, needlepoint ivy, sweetheart ivy, and California ivy, this plant contains a toxin that, if ingested by pets, can result in vomiting, abdominal pain, hypersalivation, and diarrhea. Pothose. If chewed or ingested, pothose can cause significant irritation and swelling of the oral tissues and other parts of the gastrointestinal tract. Schefflera. Schefflera plants contain calcium oxalate crystals that can cause mouth irritation, excessive drooling, vomiting, difficulty swallowing, and intense burning and irritation. Peace lily. Peace lily contains calcium oxalate crystals that can cause mouth irritation, excessive drooling, vomiting, difficulty in swallowing, and intense burning and irritation of the mouth, lips, and tongue in pets who ingest. It is very toxic to cats if ingested. Jerusalem cherry. The Jerusalem cherry contains the toxin solanine. This causes drooling, vomiting, diarrhea, and ulceration when consumed and may also produce central nervous system signs, e.g., depression, seizures, etc.
Holly.
When holly is ingested, it can result in vomiting and diarrhea if ingested. Most pets lip smack, drool, and head shake excessively due to the mechanical injury from the spiny leaves.
Snake plant.
Mother-in-law's tongue when ingested by pets. It typically causes drooling, vomiting, diarrhea, etc. Seeds of fruits. The seeds and pits of the apple, apricot, cherry, peach, and hydrangea are toxic and will give your pet cyanide poisoning. This causes labored breathing, red gums, and an inability to hold their urine or feces for any time.
Belladonna.
All parts of the belladonna plant contain toxins. But the shiny, black berries inhibit nerve impulses by blocking receptors in nerve cells, causing hallucinations, depression, an elevated heart rate, and possibly respiratory failure. This plant also causes nausea, vomiting, and dilated pupils. Toxic to humans and pets. Supervise your pet when they are outdoors to prevent them from ingesting toxic plants in the yard or garden. Regularly inspect your home and yard for any potentially toxic plants. Porcupine quill injuries. What are porcupine quill injuries? Porcupine quill injuries occur when a pet encounters a porcupine and is struck by its quills. Porcupine quills are sharp, barbed structures that can easily penetrate a pet's skin, fur, and internal organs. These injuries can vary in severity depending on the number of quills and their location on the pet's body. Signs and symptoms. Swelling, pain, redness, and localized inflammation around the affected area. In more severe cases, quills can become deeply embedded in the skin, causing abscesses, infection, and potential damage to underlying tissues or organs. Treatment for porcupine quills. Do not remove deeply embedded quills. If quills are deeply embedded, broken off, or located in sensitive areas such as the face, mouth, or eyes, do not attempt to remove them at home. Clean the area. Once superficial quills are removed, clean the affected area with mild soap and water to help reduce the risk of infection. Avoid applying ointments or antiseptics unless directed by your veterinarian. Monitor for signs of infection. Keep a close eye on your pet for signs of infection, such as swelling, redness, discharge, or fever. Look for hidden quills. Look for hidden quills within your pet's fur. If you do not remove these, the wound will fester and become infected. You will need to be feeling around for the blunt end of the quills, as the sharp end will be embedded in the pet's skin. It's crucial to remember that porcupine quill injuries can be painful and potentially severe, requiring professional veterinary care for safe and thorough removal. Even if you've removed superficial quills at home, your pet may still have deeply embedded quills or other complications that need attention from a veterinarian. Rabies. What is rabies? Rabies is a viral disease that affects mammals, including dogs. It is caused by the rabies virus, which belongs to the lyssavirus genus. Rabies is a zoonotic disease, meaning it can be transmitted from animals to humans. The virus typically spreads through the saliva of an infected animal, usually through bites. Signs and symptoms. Behavioral changes, difficulty swallowing, paralysis, aversion to drinking water, and change in voice. Once symptoms manifest, rabies is almost universally fatal. Therefore, prevention is the primary focus of rabies management. Phases of rabies. Revaccination. Dogs and cats vaccinated with rabies should be revaccinated immediately and observed for 45 days in isolation. Prodromal phase. During this phase, the animal undergoes a marked change in temperament. Quiet animals become agitated, and active pets become nervous or shy. This phase can last 2 to 3 days. Furious rabies occurs when the rabid dog becomes aggressive, highly excitable, and displays evidence of a depraved appetite. Paralysis eventually sets in, and the animal finally dies in a seizure. Ringworm. What is ringworm? Despite its name, ringworm is not caused by a worm but rather by a group of fungi known as dermatophytes. It's a highly contagious fungal infection that can affect the skin, hair, and nails of both humans and animals. The name ringworm comes from the characteristic ring-shaped rash that often appears on the skin of infected individuals, resembling a worm's shape. Various species of dermatophyte fungi cause ringworm. These fungi thrive in warm, moist environments and can be transmitted through direct contact with an infected animal or indirectly through contaminated objects. Treatment of ringworm. Environmental decontamination. Since ringworm is highly contagious and can survive on surfaces and objects, it's essential to thoroughly clean and disinfect your home environment to prevent reinfection. This may involve washing bedding, clothing, towels, and grooming tools in hot water with detergent, vacuuming and disinfecting floors and surfaces, and isolating infected pets to prevent transmission to other animals. Treating pets. Treatment for pets may involve topical antifungal medications, oral antifungal medications, environmental decontamination, and isolation to prevent transmission. Stings. What are stings? Stings in pets typically refer to injuries caused by the stingers of insects such as bees, wasps, hornets, or ants. When an insect stings a pet, it injects venom into the skin, leading to localized pain, swelling, redness, and sometimes itching. Signs and symptoms. Depending on the severity of the sting and the pet's sensitivity to the venom, more severe reactions can occur, including allergic reactions characterized by difficulty breathing, hives, facial swelling, vomiting, diarrhea, weakness, or collapse. In some cases, multiple stings or stings in sensitive areas like the mouth or throat can lead to life-threatening complications. Treatment for bee/wasp stings. Remove the stinger, if present. If you can see a stinger embedded in your pet's skin, use a pair of tweezers or your fingernails to scrape it out carefully. Apply a cold compress. Use a clean cloth or ice pack wrapped in a towel to apply a cold compress to the affected area for 10 to 15 minutes. Remember to remove their collar to help the swelling. Administer antihistamines. If your pet shows signs of itching or discomfort, you can give them an over-the-counter antihistamine. Baking soda will help neutralize the venom. You can use 1 teaspoon mixed with water on their skin or inside of their mouth if needed. Treatment jellyfish stings. Remove tentacles. If tentacles from the jellyfish are still attached to your dog's skin, use a pair of tweezers or gloves to remove them carefully. Be sure to protect yourself from getting stung. Rinse with seawater. Rinse the affected area to help remove any remaining venom. Avoid using fresh water, as this can trigger the release of more venom from the jellyfish cells. Apply white vinegar, a commercial vinegar solution, to the sting site to neutralize any remaining venom. Vinegar can help deactivate the nematocyst's stinging cells and reduce pain. Apply a cold compress. Use a cold compress or ice pack wrapped in a towel to apply cold therapy to the sting site. This can help reduce swelling and alleviate pain. Monitor for allergic reaction. Keep a close eye on your dog for any signs of an allergic reaction, such as difficulty breathing, swelling of the face or throat, vomiting, diarrhea, weakness, or collapse. Provide pain relief. Avoid giving your dog pain medication containing aspirin or other ingredients that may harm pets. Treatment for scorpion stings. Remove the scorpion. If you see the scorpion still attached to your dog's skin, carefully remove it using tweezers or wear gloves to protect yourself from getting stung. Clean the wound. Gently clean the area around the sting with mild soap and water to help prevent infection. Avoid scrubbing the area, as this can aggravate the skin. Apply a cold compress. Use a cold compress or ice pack wrapped in a towel to apply cold therapy to the sting site. This can help reduce swelling and alleviate pain. Swallowed objects. What is a swallowed object? A foreign object swallowed by pets refers to any non-food item that is ingested and becomes lodged in the gastrointestinal tract. This can include toys, bones, rocks, socks, fabric, rubber bands, or even parts of plants. Signs and symptoms. Bowel or stomach obstruction/blockage, vomiting, diarrhea, abdominal pain, lethargy, loss of appetite, difficulty defecating, and, in severe cases, signs of shock. Swallowed objects can also cause perforations or tears in the digestive tract, which can be life-threatening if not treated promptly. Assess the situation. If you witness your pet swallowing a foreign object or notice signs such as choking or distress, try to determine the nature of the swallowed object and if it's safe. Monitor your pet. Keep a close eye on your pet's symptoms and behavior. If they are showing signs of distress or discomfort, contact your veterinarian immediately for guidance. Prevent further ingestion. Remove any additional foreign objects or potential hazards from your pet's environment to prevent further ingestion. This includes toys and household items. Do not induce vomiting. While inducing vomiting may be appropriate in some cases of foreign object ingestion, it can be dangerous if the object is sharp, caustic, or has the potential to become lodged in the esophagus. Offer water. Encourage your pet to drink water to help keep them hydrated. However, do not force your pet to drink if they are unwilling or unable to do so. Minimize activity. Encourage your pet to rest and avoid strenuous activity, which could exacerbate any discomfort or complications associated with the foreign object ingestion. Ticks. What are ticks? Ticks are tiny arachnids that are parasitic and feed on the blood of mammals, birds, and sometimes reptiles and amphibians. They are ectoparasites, meaning they live outside their host's body, attaching themselves to the skin and feeding on blood for sustenance. Signs and symptoms. Visible ticks, skin irritation, excessive scratching, licking, lethargy, fever, loss of appetite, swelling, joint pain, lameness, pale gums, jaundice, coughing, and difficulty breathing. Treatment for ticks. Tick removal. If you find a tick attached to your pet's skin, it's essential to remove it promptly and properly to reduce the risk of disease transmission. Use fine-tipped tweezers to grasp the tick as close to the skin surface as possible and pull upward. Avoid twisting or jerking the tick, as this can cause the mouth parts to break off and remain embedded in the skin. Tick prevention products. Tick prevention products such as spot-on treatments, oral medications, tick collars, or repellents can help protect your pet from future infestations and reduce the risk of tick-borne diseases. Urethral obstruction. What is urethral obstruction? Urethral obstruction in cats, also known as feline lower urinary tract obstruction, FLUT, is a severe medical condition where an obstruction occurs in the urethra, the tube that carries urine from the bladder to the outside of the body. This obstruction typically occurs due to the formation of urinary crystals or stones, mucus plugs, or urethral strictures. Signs and symptoms. Straining to urinate, vocalizing while urinating, frequent trips to the litter box with little to no urine produced, licking the genital area excessively, signs of discomfort or pain, and in severe cases, complete inability to urinate. Treatment urethral obstruction. Contact veterinary care. Even if you suspect urethral obstruction, you must immediately contact your veterinarian or emergency veterinary clinic for guidance and to inform them of the situation. Hydration. Ensure your cat has access to fresh water. Dehydration can worsen the situation, but do not force your cat to drink. Litter box. Ensure your cat has access to a clean litter box. Some cats may try to urinate repeatedly to clear the blockage, so having a clean litter box nearby can be helpful. Try to encourage urination. Sometimes, gently massaging the lower abdomen can help stimulate urination, but be very gentle and careful not to cause further stress or discomfort. Monitor symptoms. Keep a close eye on your cat's symptoms. If you notice any signs of distress, such as vocalization, lethargy, or vomiting, it's crucial to seek immediate veterinary care. Keep calm. Stress can worsen the condition. Keep your cat calm and in a quiet, comfortable environment.